In America, everyone counts, and the 2020 census is how that great promise is kept. Respond today online, by phone, or by mail, and help inform hundreds of billions in funding for education, health programs, and more. Shape your future. Start at 2020census.gov. 500,000 children in the United States have been diagnosed with COVID-19, folks. There have been 513,415 cases involving children. 70,630 new child cases were reported from August 20th to September 3rd. Children represent, folks, nearly 10% of all reported cases, according to the American Academy of Pediatrics and the Children's Hospital Association. Again, those numbers, 70,630 new child cases. Now, within 2 weeks, child cases increased 16%. The total number of cases, again, 513,000. That's what the total number is. Now, of course, what is happening is kids are also going back to school. That's one of the reasons why you don't see folks in the classrooms, because we still don't know what the impact is. And this is following, of course, numerous Republicans who say, oh, children don't get it. Donald Trump says they have the sniffles. No, children are dying from this as well. Joining us right now is Dr. Dan Fagbuyi, Pediatric Emergency Medicine Specialist. Doc, glad to have you back on the show. To listen, first of all, we're going to talk later about Donald Trump downplaying coronavirus. I'm going to get your thoughts on that as well. But the thing that jumps out here is that you've heard from him and others who say, oh, children, no big deal. It's the sniffles. It goes away in a day. No, we are seeing children die from coronavirus.
That's correct. Thank you for having me again. Yeah, we've been seeing this case rise, especially in the past 4 weeks in children. We've definitely seen that, and in college kids, just because the summer's pretty much over and they're returning to school. There's been a lot of mixing, and we're also seeing this surge, especially in the Midwest states, just an increase in the number of patients who have been seen in different hospitals who have been diagnosed with coronavirus. If you look at the total number in the United States, that means 10% of the cases of COVID that we're seeing now in the whole states, out of the whole 6 million, are accounting for children. So that's a big deal.
And so when you talk about this here, just like with we're seeing young folks dying of heart attacks because of the impact of COVID on the heart. We don't know how COVID is impacting different generations, of whether it's children, whether it's teenagers, whether it's adults. That's why people keep yelling, you can't just go back to business as usual, because folks like you don't know what this thing does.
That is correct. The point is, as I've been saying all along, COVID is keeping us humble. Let's call it what it is. It's a disease. It's an infection that is scary. It's not mean for us to panic, but it's for us to do the things we need to do, the hand washing, the social distancing, and trying to make sure we're wearing our mask and doing all those things. But in addition, we have to have right leadership in place that actually cares about us and cares about the whole country as a whole, especially since it's affecting us and our community more in a disproportionate rate than is going on. Yep. And with regards to the athletes and even the kids who are playing different sports, the young adults who are getting it, they're actually getting a myocardial infection, basically our fancy term for it's affecting your heart, the heart muscle, the heart walls, and it's causing death in some patients. And that's concerning. We don't know the real long-term effects of COVID. I've been saying this a lot. There have been many studies that have shown it's even affected their lungs that we don't even know, even though you're asymptomatic. When you do a random CT scan on those patients, you see some findings in the lungs, findings in the brain, and other parts. So we're still learning. We don't know it all. We don't know it, and we need to call it what it is. We don't know. We're watching. So you don't want to get the disease if you can avoid it.
Is it from your perspective, is it still smart not to have kids in school, that in order to practice safe distancing and going to virtual school?
So the key thing with regards to school, I mean, education is important. Their socialization is important. You have kids who have developmental disorders, autism, and other things where they need to socialize. The kids who depend on the school lunches, all the other things we've talked about, and the sentinel events that you pick up, be it child abuse and other things that teachers and all those pick up. But at what risk? So you have to weigh the risk-benefit ratio when you're making these determinations. But some of the key things that you have to make sure you're aware of is what's the positivity rate in my community, i.e., in where I live, what's the positivity rate? That's the rate of out of the number of tests that we do, and everybody divide, and you take the number of positive tests and you divide that number by that. So number of tests we did, that's the bottom number, and then the number of people who turned out positive, and you divide those numbers, you get a positivity rate. It should be less than 5% in your area. Ideally, 1%. Ideally, it should be 0%. But in those cases, that's when you can start to consider that. And then what other things do you have in place? The contact tracing, is it in place? Is your local health department involved in that whole process? Is your school involved with that process? Is everybody wearing a mask, all faculty and staff? And is there a notification system so we can talk to the parents and say, hey, you don't have to bring this person to school today, or this adolescent doesn't need to come to classes today. You can do that at home. So it all depends on the whole community approach and everybody involved. So there are some balances. There are some places in schools that can open safely, and there are some that can't. It's all dependent on the disease and the spread in that area and what things and policies you have in place, which is the key thing, the policies, what goes around that.
I want to get your thoughts on this latest big story. Bob Woodward has a book on the Trump administration. Donald Trump gave 18 different interviews to Bob Woodward. And we now, of course, have Trump saying that he purposely downplayed the coronavirus because he did not want to cause a panic. I just got to get your thoughts on that. This was back in March when the interview took place. We were in the heat of coronavirus. And for him to say that, yeah, he was publicly downplaying it, even though it was a major deal, that has to tick you off.
Oh, yeah, definitely. I went ham on them on Twitter earlier today, just going in. Facts. We've known this. We kind of hypothesized this. You didn't kind of call it out. You're just saying, like, you got to understand, you had the experts around you, so they must have been advising you. And we find out that you had a call that gave you this information and you were downplaying it. That's one, irresponsible. It is basically a dereliction of duty. I said, as a military personnel, basically you kind of just blown out the whole human rights thing. And then from a public health and public health security standpoint and national security standpoint, and that's my biodefense hat now, I'm getting on that. It's concerning. It's really just like you just basically left us hanging. That's what it comes out to. And you realize that there was a purpose and a goal for you and selfish and letting the public basically be harmed. That can be considered malpractice if it were a doctor. If you're somebody who basically owns a business, basically you have false advertising and you misled them wrong. And now you actually have death, bloodshed on your hands. That's the big deal.
All right, then. Dr. Dan Fagbuyi, I sure appreciate it, man. Thank you so very much.
All right, my pleasure.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. As our community comes together to support the fight against racial injustice, I want to take a second to talk about one thing we can do to ensure our voices are heard. Not tomorrow, but now. Have your voices heard in terms of what kind of future we want by taking the 2020 census today at 2020census.gov? Now, folks, let me help you out. The census is a count of everyone living in the country. It happens once every 10 years. It is mandated by the U.S. Constitution. The thing that's important is that the census informs funding, billions of dollars, how they are spent in our communities every single year. I grew up in Clinton Park in Houston, Texas, and we wanted new parks and roads and a senior citizen center. Well, the census helps inform all of that and where funding goes. It also determines how many seats your state will get in the U.S. House of Representatives. Young black men and young children of color are historically undercounted, which means a potential loss of funding for services that helps our community. Folks, we have the power to change that. We have the power to help determine where hundreds of billions in federal funding go each year for the next 10 years. Funding that can impact our community, our neighborhoods, and our families and friends. Folks, responses are 100% confidential and can't be shared with your landlord, law enforcement, or any government agency. So please, take the 2020 census today. Shape your future. Start at 2020census.gov.